Welcome back to forpay.org. This is Consumers Dr. Vengala. I've been talking a lot about on healthcare. One thing which I've mentioned several times is personalized healthcare. What the heck is personalized healthcare, you might ask? I want to clarify that, folks. Today's topic is personalized healthcare. When there are two things in healthcare, a lot of people tend not to look into it. Healthcare is when you receive the care from the providers, like doctors and hospitals and ancillary facilities. The second part is how you pay for it, how you finance it. When I say personalized healthcare, basically I'm focusing on how you personalize financing the healthcare part. How do you finance your healthcare? This is where my focus is. It has always been healthcare, yes, but I'm talking about personalizing the healthcare. How do you personalize and buy what you pay for? What I mean is, when you buy a health insurance, we buy what we need. We don't need to buy anything more, anything less. Traditional health insurance is, their days are numbered. Traditional health insurance has no role in healthcare. I'm looking into a deductible healthcare policies. Why do you say you need a deductible? Only reason why I'm saying deductible is you can, when you buy an insurance, whatever the premium you pay, $200-300, which it's an expense. Not only that, when you have a deductible component to it, IRS will let you deduct the entire premium you pay for the health savings accounts. So there are two parts to it. One is the health insurance part, the other one is the health savings. Health insurance, when you buy a deductible policy, your premiums will go down. Instead of standard $300, it might go down to $200 because you have a $1,000 deductible. I hope I'm clarifying that. If you have a $1,000 deductible, your premiums will go down. So you can easily say it is $200 deductible, which is an expense. You can write it off on your taxes. Not only that, you can also put money aside into health savings accounts, which I've been talking lately, like $10 a day, $300 for individual, and $3,600 per year. If it's a family, $20 a day, $600 per month, and you're talking about $7,200 for your family. You can deduct it. Folks, you don't have to pay taxes on your contributions. So it's a deductible event. So you can bring your taxes down. Whatever your income level is, I understand for the folks, I'm talking about folks in the $50,000 to $60,000 range, but if it's a lower income bracket, there are ways to do that too. But I'm focusing on around $50,000 to $60,000 in income, and you can put money aside into the health savings. Then what is this personalized healthcare? This is where it comes in. Healthcare, on health, you can make lots of money, folks. You guys have no idea. You can make lots of money on health, as long as your personal responsibility towards your body, your health, your family's health. You need to focus on that. nowadays in healthcare, with the telemedicine, telehealth, and so-called Google medicine, you can get all the information right at your fingertips, on your mobile phone. If you have any health-related questions, you can ask forpay.org, or you can ask Google, you can ask Siri, you can ask, you will find the answers, folks. You will find the answers. Alexa will give you the answers. Alexa, I have a headache. What should I do? It'll give you the answers. Alexa, I have a cough and cold. Most of it is a home remedies, folks. Why do I say that? That is the way you save money, put aside. So you're not using your health savings accounts. Keep accumulating every year, year after year, year after year. This is better than IRA, traditional IRA, even Roth IRA. I would recommend highly health savings accounts, which has a triple tax benefit. So when I say personalized healthcare, this is what I'm talking about. Lower your premiums on your health insurance premium by taking a deductible policy and put money aside into the health savings. And when you need health care, you try to figure out, you have to be responsible. There are ways to take care of yourself. You don't need to go to a doctor right away. People, when they have health insurance, oh, I'm not paying for it. Somebody's paying. That's the attitude. It's not there now because you're spending from your pocket. So you will be careful in picking and choosing your healthcare provider, your health insurance premium. You will be careful even getting, even operated upon, unnecessary surgeries, unnecessary procedures. You can avoid all that. This is what I'm talking about. Personalize your healthcare by picking and choosing what you want rather than what somebody tells. Even if you go to the provider, you need all the answers before you decide if you really want. If it's good for you or your body and you need to have the surgery, you will make a wise decision, folks, because you are spending the money from your pocket. This is what I meant, personalize. And can you imagine if you put money aside for your individual $3,600 a day in 10 years, $36,000, and you're talking about it'll be 50,000. It'll grow to around 50 to 60,000 if you put it in the index funds, which grows with the market. And the same thing for a family of 70 to 100 goes a long way, folks. 72,000 in 10 years, which becomes almost over 100,000 for your family. When you have a health savings, when you have a debit card, if you have to use your money, you will be careful in picking and choosing what you want. And if you really want something done, you have no hesitancy in paying for it because that's what you need and your family needs. I think this is what I've been talking about. Personalizing the healthcare empowers the consumer, empowers you rather than the insurers. So it empowers all of you to lower the costs of the healthcare. Ultimately, it lowers the cost by you folks as a consumer. You will demand affordability. You will demand competition. You will demand transparency. This is what we need, folks, for healthcare to get better, for the U.S. healthcare to better. Consumer-driven, personalized healthcare. I hope I answered the question when I say personalized healthcare. That's what I mean. paying part of it. You personalize depending on what your needs are. I'll keep talking about this consumer-driven, personalized healthcare. Thank you for joining. Thank you for listening. And if it interests you, you can go ahead and subscribe and share and make some comment, folks. We will see you next time. Thank you. God bless. Goodbye.